Hold on.
Hold on. Take 2, scene 3, clapper.
Action.
Hi, my name is Dr. Jane Goldberg. We're gathered here together at my center, which is La Casa Spa and Wellness Center, and I'm very happy to meet all of you here and to share with you the musings of this very smart, very knowledgeable man who I only met 2 weeks ago, but was very taken with the speech that I heard him give then and wanted to share it with as many people as I could. Before I give the floor to Dr. Hal Blatman, I just want to tell you that I'm about 3, maybe 4 months away from reopening my center in Puerto Rico, La Casa Spa and Wellness Center Puerto Rico, as opposed to La Casa Spa and Wellness New York, which I'm very excited about. I've been spending over a year now renovating it, and it used to be open as a retreat center, resort center, that kind of thing. So I invite all of you to read my musings from 20th Street if you're not on it, and then you'll be up to date about the ongoing renovation and when we actually are going to open. So Mr. and Dr. Blatman both, because he is a Mr. and he's also a doctor, he just said some things that I've never heard before when I heard him 2 weeks ago. And he's going to tell us some really interesting stuff tonight. So thank you.
Welcome.
Thank you for being on Earth, and thank you for sharing the fruits of your education, your interest, your curiosity, your research, and all of what it is that you know and that you're going to tell us tonight.
Okay. All right.
I guess I'll sit here.
Yeah, please. I'll start with who I am and where I come from. I was born in Cincinnati. My father worked for GE, so I was about 5 years old, moved to Pittsfield, Massachusetts, and my father still worked for GE, so I was about 10 years old, moved to Philadelphia and Valley Forge. So I grew up on the East Coast. I went to high school in King of Prussia. If any of you have been to the mall there, I used to push carts in the Acme supermarket when it was there. And then I went to Penn State University. I was a Nittany Lion, and then to Philadelphia for medical school. And then back to Cincinnati. My wife found us a place to live 2 blocks on the same street from where I was when I was 3 years old. And I was residency training in orthopedic surgery. And one of my favorite things in those days was to put fingers back on when people got them cut off. That was my fun with microscope and sewing the nerves together and the arteries together and pinning the bones back together, and it works. You put fingers back on, they can work pretty well if it's done right, and they get, I won't go into that. But that was about my favorite thing to do. And I left orthopedics after 2 years. I was more to life than orthopedic surgery, and the people I was with weren't happy, and I decided I didn't want that. And I started working for an urgent care office. And a dentist new in town walked in within a few weeks of me starting there and said, "Have you ever heard of TMJ syndrome?" This was 1982, the dark ages of medicine. I'd never heard of TMJ syndrome. Neither had most people, but I had it. And he proceeded to teach me how to put my fingers in somebody's mouth and find where their sources of pain were. And I never looked at headaches the same way again. And I sent all the urgent care headache patients to him if they were interested in getting better and not just taking medicine for their headaches. And that worked along pretty well. And I knew I needed to go back to school because I wasn't board certified or board eligible in anything. And what I ended up doing was going back to school in occupational environmental medicine and toxicology. So I'm actually board certified by conventional medicine to find and take out of your body the heavy metal poisons that you have and to understand the deeper levels of toxicology that you were talking about before. As I was doing this, it didn't occur to me that what my friend had taught me about head and neck pain applied to the entire body until I was working in an urgent care on a Sunday morning, and this woman came in with pelvic pain. And her abdomen was extremely tender, and this was the mid-1980s, and I looked like Dookie Howser back then. And this woman was 20 years older than me, and she did not have a sexual history that went along with the pelvic inflammatory disease that I was taught she had, and what she did have didn't make any sense to me. So my medical director had given me a monograph written by Janet Travell. Janet Travell was the founder of myofascial medicine, She was one of Kennedy's physicians in the White House for his back pain. And I was carrying her monograph around, and here I am with this woman with the pelvic pain. And I said, you know, instead of an intravenous line and a hospital ride with the ambulance and all that, how about if we just maybe stretch out the muscles in your belly and see if that changes, and we can always do the pelvic exam and the IV and the ambulance afterwards if it doesn't work. Well, me being like Dookie Howser and her being 20 years older than me and not wanting that ride to the hospital, she said, okay. And I went and got that monograph out and put it on the counter behind me, laid her on the table, and there were nice pictures in the monograph that kind of showed me what to do. And in about 5 minutes, all of her pain was gone, and this extremely tender abdomen was no longer tender, and I was scratching my head wondering what it was I'd just done. I don't believe anything I can't see, touch, and feel, so I got permission to call her back in a week. The pain was gone in a week, and I read the rest of the monograph. And I realized at that moment that what I had been taught about head and neck and face applied to the whole rest of the body. That was 1987, 1986. And I called my dental buddies and asked them what to get, and the clinic I worked in humored me, and they bought me dental syringes and fluoromethane, and I started to poke people with needles. And I taught myself myofascial medicine in the next year, so that the clinic I was working in that closed at 10 sent their last patient out at midnight, and nobody ever complained because the level of medicine we were doing was way different than what was in the community, and things with neck pain and back pain and car accidents were getting better. And they didn't teach me that in orthopedics. So I'd learned something I didn't know before. And the practice was so successful that when I finished the occupational medicine residency in 1988, I opened a practice to treat myofascial pain. And so now this is...
So how were you using body work, or were you using injections, or both?
Both. Body work and needles. But I used fluoromethane, I used my hands, and I used needles when my hands weren't enough.
Did you use dry needling like that?
No, I was using needles with Novocaine in those days. Which isn't that much different than dry needling, except you get a little less pain afterwards. And so this is now 2017 and 13,000 patients later. So there's a wealth of experience, but there were some interesting catalysts that changed my life further as I went through. And one of them was my wife coming home one day and saying, there's a physical therapist I've met and you need to meet her, so I've invited her over for dinner. And she came over for dinner and introduced herself and then told me that my skull bones moved. And I said, well, maybe yours do, but I went to medical school and mine fused when I was 2. She goes, no, nothing fuses. Fusion is pathology. And I said, well, maybe you didn't go to medical school and you don't know that your bones fused when you were 2. And then our conversation was peaceful again until after dinner, where she said, how would you like to go in the living room and let me show you that your skull bones move? I humored her, laid down. She said, do you feel that? And my head is in her hands. And I said, yeah, your hands are moving. She goes, no, that's your head. I said, maybe you missed that part about my skull bones fused. She said, why don't we switch places and I'll put my head in your hands. So that was a great idea, because I know where my hands are and we can find this out. And as soon as her head touched my hands, I knew that what I learned in medical school was wrong, because her head bones moved and it wasn't my hands. And that led me to another transformation and said, well, if that's craniosacral therapy and they can teach me that, I'm going to sign up for their classes. And so I took enough craniosacral therapy classes to be a craniosacral therapist. And on the path of that, I learned that you can feel energy off body. And Janet Menken, who founded Healing Touch, lived in Cincinnati, taught courses in Cincinnati. I took enough classes to be a Healing Touch practitioner. And I can call myself all those names. They all work for me. But I integrated that skill set into my other skill set. That was 1990s. And I developed this practice into a pain practice and a reconstruction medicine practice. And then, about 5 years ago, I got introduced to ozone. I was teaching at a conference in New Mexico and hooked up with a friend I hadn't seen in 15 years who's a pain doc in Pittsburgh, and he said, what are you doing now? He said, ozone, you got to go learn this stuff. And I said, you're nuts, I do platelet-rich plasma, I don't need to do ozone. He says, go take this class. So I took the class. I find myself in a room with 80 doctors from around the world who are going, I'm just here because somebody told me I need to take this. I'm not sure about this. That was our conversation at 9 in the morning. Our conversation at lunchtime was, holy smokes, there's science here. Our conversation with dinner was, this is so much science, I can't wait to see what this does in my body. And I had a bad cold, and I got ozone in my blood, and my nose didn't run the rest of the day. And I'd filled up the trash can the day before with my Kleenex. And then the next day we were putting it into people's bodies with needles, and that was the prolozone I was asked about. And there were people who knew of me in this class and knew of my work, and came and said, if I go get the needles and the syringes, would you inject this in my neck? And I said, well, sure. If you go get that and lie down on the table, I'll come do my thing. So here I was injecting this person's neck, and there was a crowd around my table, and somebody going, what's he doing? That's not taught in this class. And I heard shh, and then another shh, and I just did my thing. And the next day, I examined these people and asked them how they were doing, because I'd never injected gas into muscle. And I felt the change in the muscle, and the change was incredible. And I knew that this was going to change my life. So by the time I got back to Cincinnati, I had already ordered an ozone machine, and I already had one on delivery, because I wasn't going to go a day without one. And from there, I came to work in New York. I have two sons. One is in Seattle and one is in New York. And my son in New York said, Dad, if you want to change medicine, and you want this work to be noticed, it's not going to happen in Cincinnati. You've got to come to New York. And I kind of stuck that in my head and didn't do anything for a couple of years. And then I had some good friends. He's a physician, she's a nurse, and she got a total knee replacement, knows what I do, and never called me. And I'm thinking, what am I doing here? I do not need to be doing this. Maybe I do need to be in New York. So 3 months later, I had a license to practice medicine in the state of New York, and I had a place to practice. That has evolved. And I got called to come work at the Ash Center when Richard Ash died. I don't know how many of you know that. And under the mentorship of Russell Jaffe, one of the smartest people I've ever met, and he said, we don't use ozone at the Ash Center. Why do you want to use it? And I explained to him what it did to the muscle. He said, why are you using that? Why don't you use nitrous oxide gas? I said, nitrous oxide? What is that going to do? And he went over the biochemistry and toxicology of all these things for me, because he is a biochemist, a toxicologist, a clinical pathologist, and an internist, and has PhDs, residencies, and boards in all of them. Yeah, really. So I listen to what he has to say, and he takes me under his wing, and we have conversations on Sundays when I get confused about something. He explains to me the deeper nature of how the biology works, which has been wonderful. But he understood what I wanted to do, and he explained what nitrous oxide would do. And so I started to inject that into muscle, and that's painless. That's been fascinating, and it does what we need it to do. So that's where I came from. Any questions on that so far? So here's what I've learned and figured out. When it comes to pain, I've invented 5 rules that I call the Blatman method of CSI for pain. Because when you go to the doctor, where does my pain come from, or help make my back pain go away, you're asking the doctor to play CSI and figure it out, right? So, 5 rules for CSI. Rule number 1, you cannot believe where you think you hurt. Your headache does not come from your head. Your left arm pain could be your heart attack. Your knee pain most likely doesn't come from your knee. And I'm explaining this to a new patient last week. And he's there for back pain, and he says, well, by the way, I had a total knee, and this knee still hurts. I said, well, you don't have a knee anymore. The pain you think is in your knee cannot possibly come from plastic and metal and titanium. Something else is making you think your knee hurts. And then he got it. So you all get that too. And your back pain doesn't come from your back. Rule number 2, you cannot believe what you think the pain feels like. Because our brain cannot tell the difference between numbness, tingling, burning, itch, tickle, pain, sharp, dull, achy, and even sexual arousal comes from the same part of your nervous system, and your body has difficulty distinguishing. Well, that's not what I learned in medical school.
So every time a doctor says, describe your pain to me, is it tingling, is it hot, is it searing, blah, blah, blah? It's irrelevant.
It's horse. It's total horse.
Fascinating.
And we're not taught that. We're taught that burning means something different than tingling, means something different than aching, and all those specifics are diagnostic. That's nonsense. Your brain can't tell the difference. And one of the clearest things for that, every patient, every visit, colors a pain diagram in my office. You shade in what your body feels like, so you don't have to tell me. Red for burning, yellow for numbness and tingling, green for cramping, blue for pain. And then if you come in and tell me, well, I don't have that, it feels like something else, I said, then write in your own key and color it. It's okay. Because the distribution of where you feel those sensations matters tremendously, but the sensation you think you feel doesn't matter. And what's also really interesting is you can feel all of them at the same time. It can be numb and tingling and burning and painful and achy all at the same time. And if you tell the doctor what it really feels like, you're crazy. Because we're taught you can't feel that. Rule number 3. If you can't believe where you think you hurt, and you can't believe what you think it feels like, what can you believe? And what you can believe is that where specifically you are tender, the fascia strings that go through and hold your body together are either tied in a knot, or it's where they weave to your body and hold on that you've injured. I'm going to show you that in a volunteer in just a few minutes. Rule number 4. Very specifically, the things that are most tender usually generate most of the pain you think you feel. So if we can find them out, and we can agree on where they are, and what you'll find is these hands, I watch them work, it's amazing to watch what they do. And sometimes I just sit back and watch and they just know. And I'm not sure how they know. But they can touch your body, please, can touch your body and tell you where your injuries are by the texture of your fascia and which ones are more tender. And usually I can feel on my side of your skin the same things you feel on your side of your skin at the same moment, and we both know what we're talking about. Rule number 5. If you get the body to heal the things that are most tender, you will usually watch the pain you thought you had go away. And what lights your injuries up like a Christmas tree and really makes them hurt is the inflammation in your strings or fascia that comes from your food. And food is very much a part of this game. I will categorically say that anyone with chronic pain, at least 40% of your pain is food-generated inflammation. And I think that's understated and is closer to 90%.
Does that include the intestinal tract? Is that
It includes your microbiome and all that stuff, how it works.
Yeah,
Yes.
okay.
But the pain and the injury that makes it happen is an engineering and structural problem. You have an injury that hasn't healed. So how does the world look at pain? Around the world, here's the scenario. Acute injury, acute pain. And then if that pain's still there at 3 to 6 months, a magic transformation happens that turns acute pain into chronic pain, and now you live with it for the rest of your life, unless somebody kills the nerve, or makes the nerve dumb, or makes your brain not able to feel pain one way or the other. That is not our reality. Our reality is injury brings acute pain. And then the real thing that we see is your body and brain will experience some evolution of that pain, whatever it turns into, until you heal the injuries that caused it, and then it will go away, which is way different. And now it doesn't matter if you hurt for 6 months or 30 years. You can still change enough of that pain to make a difference in your life. And that's what we're about. So there's a man who comes in and he colors yellow from his butt down to the bottoms of his feet. Yellow's for numbness and tingling. If you didn't remember that, I'm going to catch you up. And he settled his workers' comp claim. He had spine surgery and a fusion 10 years before. And I'm telling him the numbness and the tingling come from where his butt muscle meets his thigh, where his original injuries of lifting really happened that made everybody think he had back pain. And he had enough money to do platelet-rich plasma, which I'll explain in a minute. And so we did this technique to those specific tendons. And he comes in a month, and he says, 2 days after that procedure, for the first time in 10 years, he could feel his dog lick the bottoms of his feet. Now, everybody in the previous 10 years thought that numbness and tingling came from nerves being pinched in his spine. We don't know. That's the real part of this. There is so much your doctor tells you with absolute conviction that we do not know.
do the nerves have pathways like the blood vessels? Like, and then do they get pinched off, or is it like?
Nerves, your nervous system is not the same as mine. There is no genetic nervous system plan in our body besides brain and where they go. But how they're actually put together, everyone in this room is put together differently.
It's like a different roadmap of the way the rivers flow.
And your fascia is different. The fascia of a football player gives him more response than mine, than yours, than yours. We're all done differently. So if you look at, how do you know your finger moved 45 degrees? It wasn't 45, it was a little more. So how do you know your finger moved? In orthopedic surgery, I was taught in 1980 that there's an angle measuring nerve inside this joint that tells you that it moved. That's also nonsense. The way you know where your body is in space is the strings on top of the finger got stretched and things on the bottom of the finger didn't stretch as much. And the nerves in between those strings measure that friction, shear force, and pressure. And your brain is able to integrate that in your first 2 to 5 years of life. You look at babies, they're all over. They have no idea where their body is. But they learn a very complicated motion, and they can do and put their finger to their nose because their brain knows how their fascia moved. And if you interrupt that fascia, you can't tell where you are in space until that fascia comes back and your body relearns it. Which is a fascinating exercise.
Is that what they do like at the Carrick Institute down in Florida?
I don't know that institute, but I know we do this work, and we help put fascia back together, and so does the man in the back of the room. And Art's a fascia body worker. He smooths it out in the middle of how everybody's going. So those of you who have experienced some of that work already have put some of this together. But let me show, who's a skeptic? A skeptic in, come, can I touch your arm and your elbow?
He's a doctor.
So, thank you. Who are you?
Linda.
Linda, come stand about right over here. And take a look at Linda's arm. I'm gonna, and watch her body do this. Just, that's called a twitch response. As I go quickly over this muscle and pluck it like a string. I can even make an individual finger work. See your talking finger go? Okay? Now, the muscle that does this and controls it starts up here and it's really ropey. It's more ropey here, less ropey here, and the rope is gone there. And so is the twitch response. This texture is not tender, and this texture is, isn't it? So I can tell her where she's tender. I could also look at the other arm and tell her whether that one was more tender by what it feels like. So why is this, and the reason this is tender is because the strings of fascia that go through this muscle are tied in a knot right here. And I can feel where that knot is. It's the tightest part of this rope. The reason that's there is because where her string's attached to her right up here is injured. Feel this tenderness and that tenderness and a little bit this one. But this one doesn't hurt like the other ones. So I can tell her where she doesn't hurt as well, because her fascia texture is different. So by the texture of her fascia, I can show her where she's tender, where she's not, and where her old and significant injuries are. Let's look at upper shoulders. Can we do that too? How many people have knots and ropes in your upper shoulders? Yeah.
Everybody raise your hand.
If there's one hand that doesn't go up, you missed it. Why are these knots in your upper shoulders?
Life.
Because she's injured many, many times through that life. Because she uses these muscles in her upper shoulders to lift and carry suitcases, lift and carry kids, hold on to her book bag. And she's strong enough to contract this muscle to make that happen. But where she attaches isn't strong enough to hold her together when she pulls that hard, and her strings slip and twist into these knots. And then these knots generate the pain she thinks is a headache. That's the way we get injured. Thank you.
What about just living with that pain for as long as you just, what if your pain management, it's all relative and you just forget about it as pain?
You never know how much pain you had until it goes away.
Okay, so
And you
what?
can't imagine how much fun it is to not hurt anymore.
What is that, vacation?
And it doesn't have to come back, which is really, really cool. So, here's the parts of it. I mentioned platelet-rich plasma. And there's a gentleman in the back that does this also.
I actually had a question for you.
Yes.
About what you mentioned before. It seems you have so many good ways of treating pain. And the client or patient you described before with the muscle pain that seemed to radiate down to his feet, how did you decide to go with platelet-rich plasma versus ozone versus nitrous oxide, or just go with all three? How do you make that decision?
So let me go on with how the parts work and see if that answers the question, because it might. When you cut your knee, or skin your knee, it bleeds, right? And then you find that that bleeding turns into a scab. And then you find that 4 weeks later, that scab falls out and you have new skin underneath. And then 2 weeks later, that pink skin turns your normal color, whatever that happens to be. Everybody gets that, right? So that's how we heal. And when you pull on your arm or you pull on your shoulders and you slip these strings and they twist into these knots, your body repairs that injury as best as it can. But 4 weeks after it's done, 4 weeks after that injury, your body's done with it. If you have a partial tear of a rotator cuff tendon, it means you had a tear, your body did its 4-week repair program, and your body has no idea that it did an incomplete job. That's the deal. So if you want to get your body to do that repair again, that's all you need to do, and then it will repair it more the second time, because repairs are additive as long as you don't pull yourself apart between repairs. So if you want to get the body to run its repair cycle a second time, you need to re-injure it. So rather than jumping off the roof again or lifting something that's too heavy, take the specific area that's injured and poke it with a needle. That makes a very specific injury, and controlled and relatively small. An acupuncture needle will work, but the healing response you get from an acupuncture needle is pretty small because the tendon has a pretty poor blood supply. If we want to improve that, we add an irritant to make the body think it got more injured than just a needle poke. So we use solution in our syringe, dextrose and novocaine, or ozone, because ozone will spark the body to heal a little bit stronger.
And that's the irritant, which will cause more.
Which will make the body think it's a bigger injury than just a needle poke, so it sends bigger healing. But if we want to be even more powerful, we take blood out of your arm, concentrate the parts of your blood that would make the scab, and put that in as we poke the thing with the needle to create the injury. And now, 4 weeks later, when the scab falls out, you have new fascia parts holding you together. So your rotator cuff tendon that started like this, and now it's partially torn and looks like this, or that, or maybe this, in 4 weeks, you regrow some of what you had before, depending on how big your healing response is. So the beauty of platelet-rich plasma is you get some circulating stem cells, but most of it is the growth factors that cause your body to send stem cells to that area. If we want to do more, then we add your stem cells or somebody else's stem cells to the mix. And we have lots of ways to do that now, but the 3 primary ways that we use, one is to harvest abdominal fat through liposuction and use the stem cells in your fat and mix that with your PRP, platelet-rich plasma. Or harvest bone marrow from your pelvis and use your full bone marrow stem cells and mix that with your platelet-rich plasma. Or get a donor from the hospital and placenta and use some babies' cleaned and live stem cells and mix that with the platelet-rich plasma. They will be a much bigger procedure and much more likely to be one and done. And what you can never tell people is that they'll be one and done, but it's rare that I don't see somebody who's one and better. Most everybody's one and better. So in that fashion, we can repair where the fascia attaches. All right, so now let's look at what do we do with that ropey band and that trigger point and doing that twitching thing. So we have these ropes in our muscles that we can all feel and that are all tender. What's the major significance of that rope? Is that it's there and you're still contracting the muscle. Can you imagine that that rope of muscle is tight enough that blood doesn't get into it really well? It gets in well enough that the muscle doesn't die, But can you imagine, as you're doing all this work, that muscle isn't getting as much oxygen as it would if it was looser. That makes sense to everybody? So when a muscle doesn't get as much oxygen, now it burns fuel anaerobically. That means it's going to make a boatload of lactic acid to produce the energy to contract. And it doesn't have enough circulation through the muscle to wash that lactic acid out well enough. So what do? In 30 years of injecting trigger points, liquid will not separate fascia, and gas will. So as soon as I can force gas into that ropey band, now from the inside I can spread that fascia apart and restore circulation to the muscle. And what's also really cool is the gas is not painful. The gas is painless.
That's the nitrous oxide.
That's the nitrous oxide.
Yeah, 'cause
Ozone
I've
is
had
painful.
Ozone's very
Yes.
painful. I've had
And the
that.
lower the concentration of the ozone, the less
Less
painful.
painful. So what gamma did you use with your
I
ozone?
use from 26 down to
Okay.
6.
Okay.
At 26 micrograms per milliliter of ozone, I tapped out. At 6, I can
I've
handle
had
it.
55 and it was very painful.
Very, very painful.
Yeah.
Way more painful than any, yes.
I almost
But
passed out.
nitrous oxide is painless and does a better job
Yeah.
of that.
Wow.
Why would you mix the two together?
You could, but
I don't
don't.
Okay.
I don't know if it's-
I just one or the other.
Yeah.
If we think you've got a viral infection in the muscle, then ozone's the right idea. If we want to stimulate a joint to grow cartilage, ozone's going to work. But if I want to separate the fibers in a tight muscle, nitrous oxide is an amazing, amazing transformation. Let's talk about joints. We're taught, and if you look it up in the books, the orthopedic books say you're born with this much cartilage, whatever you got, and if you wear that out, you're done and you get your joint replaced. It's really simple. That's not true either. Does it make any sense even? We grow a new intestinal lining every 3 days. 19 billion cells per day, give or take. We grow new skin every week. We grow new brain cells. Does it make any sense we don't grow new cartilage to support our body's wear and tear through time? Doesn't make any sense to me. We grow cartilage in every joint in our body every minute of every day. Yours wore out faster in 1 or 2 or some of your joints because you've injured it and it couldn't keep up with wear and tear, so it gradually wore out. So if we want to restore a joint, all we need to do is wear out a little slower and grow it a little faster. And as long as we get that balance right, you can restore cartilage in a joint. So what can we do? For knees, glucosamine. Glucosamine by mouth, if you take a brand that works really well. If you take a brand that doesn't work, it doesn't work. So if you're taking glucosamine for your knees for 2 months, either that brand doesn't work if you're not any better, or your pain isn't coming from your knee joint. We can also, for any other joint in the body, glucosamine by mouth isn't going to work. Glucosamine has to go either by needle and injected into the joint, or in a cream and through your skin, which we call transdermal. And so we have a glucosamine formula that works really well from your jaw to your big toe and helps restore joints. And you need that every single day to repair from wear and tear. What do we do for joint pain? We give it ibuprofen. We give it non-steroidal anti-inflammatory medicines, which stop or slow down cartilage repair. They block glycosaminoglycan synthesis, and you can't rebuild cartilage if you take those drugs.
What about these infrared lasers and
Infrared
red
lasers are fun.
and red lasers, like this Dr. Fred Kahn made this, or I mean they're everywhere now, but
I've had one
doc
since.
up in
I've
Toronto.
had infrared light in my office since 1990.
They're awesome,
And
aren't
I
they?
use it a lot.
Yeah.
And if we use platelet-rich plasma, we always use it. And we use it to restore nerves and restore sensation, and it's amazing in many
Yeah,
ways.
because he's had a lot of success with sports injuries and
Yep.
all kinds of things.
It won't do what that nitrous oxide
No.
gas won't, and it won't do what the platelet-rich plasma and stem
Right.
cells will do.
But it does,
But it
in
does.
a sense,
Yes.
help in those
Yes,
facets.
it does.
Right.
We can also inject platelet-rich plasma and stem cells into any joint, and they also will regrow cartilage. Testimony from the little lady in the back. Friday, she got her shoulder injected with abdominal fat from liposuction and platelet-rich plasma for a shoulder that's not doing well. And Saturday, you want to talk about your, yeah, come on, come. This is how high show us how high you could get before we did this. Just looking at your arm. Can you come in where people can see you? This was done last Friday. Saturday she woke up without pain in her shoulder.
This was about it. Well, without pain, this was about it. Now I can do this.
That was last Friday.
Because actually I'm probably overusing it and have to let it heal. But still, this is, to me, amazing. It's been this way as long as I can remember.
What treatment is this?
I put stem cells from abdominal
Just the fat
fat
from
and
here.
liposuction and platelet-rich plasma taken from a vein into her shoulder. So that's amazing. Now, she did not grow cartilage that fast, but the fat has lubricated her joint and really helped her out of pain that fast, and the cartilage will grow with time. And yes, there was ozonated oxygen in that joint right afterwards. I don't put anything in a joint without also adding ozonated oxygen because it will kill things that are in the joint that you don't want, and it will minimize our risk of infection, which is the most dangerous thing when you put a needle into a joint.
Amen.
So, the parts of your question I haven't answered yet. Did I get to some of them?
Well, yeah. Actually, it's really a combination is what you're doing, so.
I do a combination. And so whatever tissue needs it, and whatever your resources can provide, we work to the limitations of that to see what it is that you need. And when we do something that's really successful, that's great. And if we do something that's not as successful as we want, that's information that helps us figure out what needs to be done next. So either way, we win. And it works pretty well.
What about tendons?
That's what we're talking, when we talked about a rotator cuff tendon.
Yeah, okay.
So let's go back to that. You have a partial tendon tear, so that means your rotator cuff tendon that used to look like this, or the tendon in your arm, or any other tendon, is now either looking like this, or that, or this. The orthopedic surgeon for your rotator cuff is going to cut this out, cut back far enough to get to reasonably healthy tissue, and drag that over and anchor it to the bone. That's rotator cuff surgery. Now you have all the pain of that procedure, and you have the physical therapy to get this to stretch out afterwards, is what happens after your surgery.
When you have a tighter shoulder and you have scar tissue that's pinching nerves.
Meanwhile, back in Wayne Manor, we can take blood out of your arm, spin it down and concentrate your growth factors, inject them into this tendon, and in 4 weeks you'll grow some of this back. And in 8 weeks you'll grow even more of it back. And if you're not one and done, you're one and better, and maybe it'll take 2 and done. And
Holy
some people
ozone,
have taken
Batman.
3. Pardon?
Holy ozone, Batman.
That's right, and we put the ozone in right afterwards. Because what we found in platelet-rich plasma is that the pain you would otherwise have 4 days later goes away in a day if I have the ozone. That's amazing how fast that works. And with this, we combine nutrition, because you need to know the do not eat list. You need to know what foods inflame your body that you need to take out. If you wake up with a stiff neck in the morning, it does not come from the pillow. It does not come from the open window. Your stiff neck in the morning came from last night's pizza. And you ate something on your do not eat list that inflamed your injuries and lit them up like a Christmas tree. And so the do not eat list is wheat, sugar, potatoes, fruit juice, hydrogenated fat and fake food, and dairy from cow. Generally in that order.
It's a real short list.
It's a real, yes. You can still eat chicken, fish, turkey, steak, vegetables, rice, and real food. But that is going to make you hurt. And so people come in and they go, oh, all this good stuff I can't, do you know how lucky you are you can't eat that? I mean, all these people and all your friends that are still putting weed killer and Roundup in their body and poisoning their children and killing their families, so to speak, which, you know, Roundup has just been labeled as a carcinogen in California.
Finally.
It's not that off the wall to say that's what is happening in our world. And every time you eat it, you get a stiff neck and pain, and you've learned not to eat it anymore. And you sit around at the table while everybody else at Thanksgiving eats the stuffing and the pie and the ice cream and falls asleep afterwards. It's not the turkey, it's the stuffing and the pie and all the other, and the macaroni and cheese that made you go to sleep. And everybody else is asleep and you're still wide awake. and then look around at the table at all the other diseases and medicines everybody else is taking, and realize you've just written yourself out of that equation as much as you possibly can.
Is that a histamine response in the food, basically, that causes all the swelling? And there's a lot of foods that I was told in my diet that to stay away from. And it was
The
like
question is
corn,
about histamine.
spinach, yeah.
Corn isn't real food. So yeah,
There you
corn's on
go.
the list
So-
too.
so-
But corn doesn't make you hurt unless you're sensitive to
To
that.
the histamine.
The list I gave you seems to be universal to our species.
I was just.
And then every person might have an additional part to their
That's
list.
what I wanted.
What was it after fruit juice?
Wheat, sugar, potatoes, fruit juice, artificial sweeteners, hydrogenated fat. I didn't mention artificial sweeteners before. And fake food and
Dairy.
dairy from cow.
Do you include GMOs as fake food?
Yes, I do include GMOs as fake food. I have
So
no
that's-
belief that that's safe for us to eat.
So that's soy and corn.
Soy, corn, sugar beets, unless labeled organic.
Soybeans.
Yes, soybeans are genetically modified unless labeled organic, to the best of my knowledge.
So all that stuff about breastfed, and still, that's no good, you know?
Breastfed for
Grass.
babies is
Grass.
grass-fed. Oh yeah. If you listen to breastfed cows, yeah, thank you. See, I'm sitting in the back. I didn't-
You know, say grass-fed.
Mark
organic.
Hyman speaks in his talks and says that grass-fed beef is as heart healthy as ocean-caught fish. And I don't disagree with that, because the data is showing that heart disease is not affected by grass-fed beef. That's pretty strong. And so that's the way I eat too.
A moment ago when you said, when you went with the stiff neck, do you mean also, or do you mean a crick in the neck as some people say?
That crick in the neck that you think is a pinched nerve, and you go to your doctor and they treat you, and they're wonderful doctors because it goes away in 3 weeks, and they fixed your pinched nerve. The food reaction from that pizza that made your stiff neck lasts 3 weeks.
And
And I don't know if your treatment made a whole lot of difference.
What about hydration now?
Hydration is important. Drinking enough water to detoxify your body is really important. Let's talk about leg swelling. How many people you know whose legs swell? Okay? And as we get older, we tend to...
Edema or more?
Edema and leg swelling. Why do legs swell? And how many people do you know that have these legs swelling and they have no cardiac issues? Because we're always taught diuretics, get rid of the
That
water.
was the other thing I was gonna ask you, are they set over 70 on blood pressure medication or have a pacemaker?
And
But 90% of those people have leg swelling.
And a lot of other people that don't even have that have leg swelling. So let me talk about what really makes legs swell and why do we really have that edema. And it's the same answer for why does an ankle swell when you sprain it. It doesn't swell. Here's why it swells. For the person with leg swelling, if you touch their legs and feel them, they're really, really tight. And remember how we talked about the toxicity of a muscle that's knotted and held really tight, and how we're using a way to expand that so we can restore blood flow to the muscle? So when you're using this muscle and it's really tight and it doesn't get enough blood flow to clean itself out, it gets really toxic. And the fibroblast cells that hook and connect to each other with multiple tentacles, they unhook and they separate and they suck fluid out of your veins and make your legs swell or make your ankle swell. There is so much healing metabolism in that ankle that in order to keep it less toxic, the solution to pollution is dilution. So your body dilutes your poisons and you see that dilution as swelling. So if you want to get the swelling to come out of the legs, you need to detoxify the muscles. That's not something you take by mouth. It's something you do with your hands, as Art would tell you.
One movement.
You get your hands into that muscle and you make it release those toxins. You put your hands into your leg and you get into this muscle, and very, very slowly, with a lot of pressure, you squeeze the stuff out along the line. You do 3 lines twice a day or 2 lines 3 times a day, you'll find it's a different leg in 2 weeks. And it may take you a month, you might be that toxic. So how do you treat an ankle sprain? We're all taught ice, rest, anti-inflammatory drugs, right? We've all heard that? So what happens when you sprain your ankle? What does your body do to that ankle? Makes it swell. We all just talked about that. Makes it hurt, so you stay off it. And does it warm it up or cool it down?
Heat.
It warms it up. Why does it warm it up? What does warming up an injury do for it? It increases circulation, speeds up metabolism, and speeds up healing. Right. We put ice on it. We take anti-inflammatory drugs. We've just stopped or greatly slowed down our healing response. Why would we ever want to do that? Because we're going to stop the swelling and stop it from hurting? Nonsense. It's not going to hurt any more with ice than it does with heat, or any less or any more, and you'll find that heat is more comfortable. So go home, prop it up, put an ACE bandage on it. So as fast as the blood can go in to deliver, you squeeze the stuff that's used up out so it doesn't have to swell as much. And you keep circulation with new nutrients going even faster and heat it up, even more than the body can do. Put heat on it, and it will heal even faster. And you'll find this ankle that otherwise would be painful still in a week might be better in 3 days. That's a way different way to treat injuries. And the underlying theme of that is, I've taken it, my approach is to think of medicine a different way. And if it doesn't make sense, why doesn't it make sense, and what would make more sense? So I passed an examination recently. I'm now board certified in integrative medicine. Ta-da! I took the exam May 20th and found out last Wednesday night. So I wouldn't be the guy to give you your cholesterol medicine. I would be the guy to teach you how to not need it. I wouldn't be the guy to give you your diabetes medicine. I'd be the guy to teach you how to make your diabetes go away. And then my forte and specialty in that is healing injuries and making pain go away by healing the injury, not by making your nervous system not work. You've seen the advertisements on Lyrica? Lyrica helps pain. So let me talk about how Lyrica really works. The way you know you're injured is the nerve endings in between the strings of your fascia that measure pressure and friction. So if I put more pressure where they're already squished by a knot, it hurts, like you found out. And if I go 2 inches away, it doesn't hurt as much because those nerve endings are not pushed as hard as much. Lyrica works by making those nerve endings not work. Can I say that again? Lyrica works by making the nerve endings that are being pressured and injured not work, so you can't tell that's going on anymore. It doesn't make you better, but the drug company, pharmaceutical company, is allowed to say it treats pain because it makes your brain not feel that you're injured anymore. That's not healing. And while it makes these nerve endings not work, it makes this one not work, and you can't remember why you went downstairs. And what we're taught in medicine is to keep giving you more and raising your dose till you don't complain about your pain anymore, and we can say it's treating your pain and you're better.
Whole West medicine is like that.
A lot of Western medicine is treating symptoms. Isn't it more fun to look at the root cause?
And meanwhile, you're creating greater resistance, and you're also getting side effects.
Yeah, exactly.
It gets more complicated as you do that. Yes?
Do you use, or what's your opinion on PEMF as sort of an
PEMF.
Yeah, pulsed electromagnetic field therapy.
Oh, pulsed electromagnetic field therapy. The body is electric, and the body runs on light energy, and the body runs on electricity energy. And with minimal, little teeny voltage changes is all it takes. So microcurrent stim, all kinds of electric things can be really, really helpful in putting energy into the body to help it. Let me introduce this book. Janet Travell and David Simons wrote a book on myofascial pain. It's 2 volumes. It's red. It was written starting in the early 1980s. And in the 1990s, I wrote to Williams and Wilkins and said I really wanted to write a book that people would understand with the same kind of information. And they said, we're not really interested in your project. So I had just bought my first notebook computer, and I sat down and I started to write this book. And 13 years later, we published it. And the book is a myofascial pain manual for people. so you can understand it. And it's got pictures in it and that show you about myofascial pain and what it is, and then that show you the pain patterns of which muscles cause pain in which parts of the body, and then a section on how do you use a rubber ball to massage those parts of the body to make those knots smaller. And as fast as you make the knots smaller, your pain is less. And then a chapter on how to stretch your body so that you can figure out how to get your fascia to loosen. And then a picture index that shows you where to look up your pain pattern and then where to go in the book to learn how to heal and work on it. And then a real index in the very back in case you want to look up something like tennis elbow and carpal tunnel syndrome. And there's a really nice section on carpal tunnel syndrome. It talks about why you get it and how to make it go away and what to do with that. Other questions before I go off on another tangent?
How would you handle a situation where it happens to be me? I had my sacrum dislocated by chiropractors, completely knocked out into left field. We're going to osteopaths now for a long time, and they've gotten me better, but I'm still suffering, I'm still dependent, and I don't feel the shift that I should. In other words, I can feel that my back and the lower part is all out of whack, just like I'm sitting here right now. I can feel
You are. You've got a twist.
Yes.
Yeah.
It's more than a twist. There's more to it, with the especially with the sacrum.
Right.
How would you handle something like that?
Look and see where you're tender.
I know what
And then-
tender.
And if I find the same things that are tender, heal that and make it go away.
Would that cause the bones to release?
It may allow the bones to release and not pull them back out of distortion, back into distortion. That's what we would hope for. But the pain may be coming more from how the fascia strings hold you together, and releasing that in this way may change the pain. And restoring the ligaments to your sacrum may help hold it in the place where it belongs. And all that is approachable. It is totally approachable. You'd know in your first visit if I'm touching the right spots. That's the key.
In a situation like that, where the condition has influenced a way of actually moving her body, so could the body keep re-injuring it by virtue of the fact that her body's kind of trained herself all this time
Her body
to
may
compensate?
re-injure itself in its own pattern as she goes,
Right, what is
but
moving
she's
that-
trying to struggle to get out of that pattern with this osteopathic work that she's doing.
Right, but
And if we restore, so restoring the fascia where it's injured may be really helpful. Yeah, that might be the next step for what you need, as long as you're already gluten and dairy free. And if you're not, you am, then that's great. You're ready for this kind of work. If you get one of these books tonight, we give away one of the balls. So you get a ball for free when you buy a book. And then, could I have the golf ball crusher? It's in the bag by me.
There's 4 free seats down front, you guys.
I don't, oh, here it is. It's in pieces. So I brought a couple of these with me also, because these are really fun. You know, if you cut your finger, what do you do when you cut your finger? Do you hold it up in the air and watch the blood drip down your arm? Do you wait till tomorrow and see how it is, and if it's still bleeding, you go to the doctor? Do you take some ibuprofen and wait and see what happens? No, that's silly, right? You put your finger on it and you stop the blood. You have pain in your body. What do you do with it? Do you take some ibuprofen, see how you are in the morning? Do you wait till tomorrow and see what's going on? Or do you put your finger on it and stop the pain? Same thing. As silly as it sounds, same thing. And what's really interesting, if the pain is coming from the fascia and you take your hands and make that fascia loosen, whatever pain was coming from it is already different, and you already know, and you don't have to wait till tomorrow. So everybody in the room can find your knots and push on them. And if you think you have lower back pain, you probably have some really tender knots in your butt. And if you take that rubber ball and put it on the butt and lean against the wall and play bear and squish those knots, you'll find your pain gets a whole lot better if that's the right answer. And how long does it last? Till those knots tighten back up again, which is dependent on what you ate and how weak your fascia is and how injured you are. If you want to squeeze these muscles up here, you got to squeeze them pretty hard sometimes. And you don't have a lot of finger strength. So we have what we call the golf ball crusher. Because these look like little golf balls and this crushing thing is really crushing. So how do you use that? Put this on these muscles and you give it a pull.
And you gotta
You
be
can put
gentle.
a lot of pressure on that. And while you're putting, see how hard I'm pushing? I didn't used to be able to push this hard. This is what's normal. And then you turn and you pull the muscle through your grippers as you do it. And when you want to loosen your neck, you put it up here and you get your neck to loosen. And if you want to loosen your legs, you put it on the back of your leg and you pull against it. You can use these. I only brought 2 of them with me. Your back is the rubber ball, because the rubber ball goes on this muscle and you can go up and down against the wall and you can push as hard as you want.
I got one last time and it's really useful.
The rubber ball is really fun, isn't it?
Well, this thing.
You got one. Yeah, you did get one of these. It's been really fun.
It's useful.
The thigh, you would get your hands into, you would find this knot in this rope, get your hands into it, and physically make it stretch out. Fella comes into my office with pain in his feet. Anybody have pain in your feet?
Is this a joke?
No, it's not a joke. Fella comes into my office with pain in his feet? No, not. You have pain.
I was at a water slide, and this is an old injury, and hit the bottom of the swimming pool as I was projecting out the end of the thing, and the bottom of my heel has hurt me for like, I can honestly.
So come sit up here.
And I have like rolled on that.
Come sit up here. He's got pain in his heel from an old water slide injury.
How old?
How old?
1994.
Okay, so sit down, let me just, I'm going to feel where his leg is tender. That's tender.
Yeah.
This is tender. That's a little less tender. That's not so tender. And this is tender,
Yeah.
right there. And then down in his heel. Down on the bottom. And is it tender when I touch it?
There. Yep.
Yeah, right?
Yep.
Okay. Now let's see how tender this one is. I want you to get the feeling that this is a lot less tender.
I've known that for a long time.
What you haven't known, he said he's known for a long time that his
No,
right
but
calf.
I've rolled through all this. I mean,
So,
honestly,
Here's what to do for it. You want to see? Put your leg up on there. Come, Gavin. Yep, right on there. Let this fall out to the side. And then I'll do the first one and you do the second one. And then let's find out if we're lucky enough that your foot pain is already better. So this is bone and this is muscle. This is going to hurt a little bit. You're probably used to it. And very, very slowly, we're just going to make this stretch. And go all the way down to there. And then you'll do the second one. And then we'll see if your foot pain feels any different. And if your foot pain's coming from this, the part that's coming from this will be different that fast. All right, go ahead. From here down to there with both your thumbs, as hard as I did and not any faster. This is going to be tibialis posterior, medial gastroc, and flexor digitorum profundus. Nice word, isn't it? That means toe flexor. Just stay on it. And do you feel that it's already less tender than when I did it?
This is sort of
Yep.
Soleus
Yep.
too, yeah.
Yeah,
That's already healed for you.
Yeah, that's right. I felt like I have a heel cord. Yeah.
And you probably do. If I want to feel your heel cord, check it out. It's got an injury right here,
How do you
a
get rid
little
of that?
injury right there.
How do you get rid of that?
Injury. Platelet-rich plasma, re-injure it, he'll grow into heel cord. All right, so make nice to it now. Make nice to it. And stand up, take a few steps, and tell us if your calf's any different, or your foot's different.
I feel it like the way
But does that pain sensation feel a little different?
yeah.
All right,
I
so,
do that a lot to myself, Doc. But
yes.
I
So if you could make this looser like this one is, that pain might not be there. That's what we're talking about.
Yeah, even at the site of the injury.
Even at the site of the injury, yes.
Whereas it hits
And
the
if
heel so
this
hard
needs it,
there.
then this will be platelet-rich plasma, but this gets treated first. So why don't you go home and do 2 lines, 2 or 3 times a day, just like we did, and see what happens to that. And then take this tendon, take this one here, and do the same thing right along there. But here, this one drives it. You won't loosen the foot without loosening the calf. So my point is, if you think that's what's causing the pain, like I do, or you look it up in the book that that's causing the pain you think is in your foot, and you do something like that, if it's the right answer, the pain's already better. That's all it took. That's what I mean. You don't wait for the bleeding to stop. You put your finger on it and make it go away. Your headache can respond the same way.
So you're saying if he can't resolve it by treating it, with that therapy for a number of days, then maybe PRP would be used?
Depending on where he's tender. And if he's tender where he attaches, that's going to be PRP. If he's more tender where the muscle is, we'll start with trigger point injections of nitrous oxide gas. And I will almost always start with that. Because if I can change this muscle to change this pain, and I don't have to charge you money to take blood and do a bigger procedure, I'd rather do it less.
You'd rather shoot the nitrous gas in.
Because unless I make your calf loose, no matter what I do to your heel, it's still going to hurt, because the pain in your heel may not be coming from there.
Okay, I don't mean to take up everybody's time, but I've had tinnitus for 7 years. That's
Yeah.
one of the most insidious things.
Tinnitus is one of the more difficult things to tackle, but tinnitus can come from tight muscles in the neck and jaw and face. So if I touch your face,
Or skull, out of place, or,
I'm going to be more looking at the face.
okay.
And if I find the muscles in one side more tender than the other side, I'm going after the ones that are tender and see if that makes things change.
All right.
Just like I did with the legs.
It's the same thing here with the whole collarbone
The whole-
base.
yes.
The leg.
And all that fascia tore when you...
Sternocleidomastoid, I mean, the whole thing.
And all that fascia tore when you got injured.
Yeah.
And it's still there and still injured and hasn't repaired
That's
any better than it
exactly
could.
right. No, it hasn't.
Right. It still needs to be repaired.
Yeah.
Tinnitus can come from the muscles in your neck and jaw.
It
And
also
even
comes
shoulder.
from chemotherapy,
Yeah.
antibiotics.
There's all kinds of things. That's why it's so difficult to find. But if it's coming from a fascia injury, we have a chance to make it change that you may not have seen before. And what I'm trying to show everybody tonight is colors you've never seen, things you've never thought of.
What do you do about bunions?
What do I do about bunions? If the bunions are big and you need to correct a physical deformity, that's going to take a surgeon to do bunion surgery. If you have pain in the joint, I start with glucosamine cream and see if I can get the joint to relubricate and work well enough that you don't need to have the surgery if you don't want it. And sometimes the pain comes from the little muscles in between the foot bones. So you learn how to treat them the same way we did your leg.
Right.
Or you put needles in them the same way. The biggest clue is where are you tender that you haven't healed from an injury that happened a long time ago. Where do these injuries happen? Jumping out of trees, jumping off swing sets. And how many of you guys jumped off an occasional roof? All right. And you remember the sting in the bottom of your feet because it was just PF Flyers and it wasn't Adidas. But you don't remember that you tweaked your hip tendons and weakened them.
I tore my labrum in my hip.
There you go. And then 30 years later, as your tissue becomes more fragile, now that's causing you pain. And now you go out and you lift too many bags of mulch, and you ate a pizza, and you blame it on the yard work. And you're going to hurt for 3 weeks.
It's old scar tissue, inflamed.
Your injuries light up and wake you up with pain when you eat food that inflames them.
But I'm a little confused about the tender spot versus the source of the injury, right? Because you're talking about go where you're tender, but also the source of that injury, if it's very old, it could be...
You don't necessarily need to treat everything that's ever been injured in your body to make something go away.
But there's an
You
order.
need to do enough, and there is an order,
So how
yes.
do you know the order of events?
30 years of experience
Uh-huh.
of knowing what I feel in your body to know what to do first, second, and third. and 30 years of doing stuff that didn't work, and other stuff that did work, and learning the difference.
And all
So that when
all
I-
the years you spent trying to get rid of it too.
Yeah, and your history of what you've done is important, but not as important as what I feel. Somebody comes with 30 years of pain and the medical record's this big, almost none of it's relevant,
Right.
because everybody's barking up the wrong tree. So I need to know some of what's been done. I teach doctors how to do this. I run continuing medical education classes for docs. And I've asked the docs, what does this class teach you? How has your practice changed in the last 6 months? And what I'll hear is, when I see a chronic pain patient, what I used to do is go through the records and say, well, you did this and this and this, so we'll try this, and if it doesn't work, we'll try that, and if that doesn't work, we'll, right? We don't do that anymore, they said. What we do is, we might look at the old records. I'm more interested in the story of what happened, but then I want to touch your body and find out where it's tender and get those injuries to heal, and I watch the pain go away. People talk about phantom limb pain. You know anybody's had an amputation? And
That's the Carrick Institute. They actually put a mirror like this where the guy's like lost his arm, and then he'll move his other arm.
yes, that's fascinating work.
That's absolutely
Fascinating
one of the
work.
most incredible
here's-
stuff I've ever seen. in
Here's
my life.
something also interesting. Pain in the foot comes from a muscle in the calf, right?
Right.
Pain in the foot comes from a muscle in the calf. If you take the leg off, you still have the muscle. It's still sending pain to the foot. And the muscle doesn't know there's no foot there.
That's the stuff that those guys do down in
That's-
Florida, the Carrick Institute.
We've been doing that for 20 years,
It's
and we
some-
watch phantom pain go away. Most amazing thing.
It really.
Go after the
What they're
things.
doing-
Pardon?
What they're doing, what is that example with the mirror?
He can explain probably better than I can, but
I'm going to be rough on it too, but let's talk about it after.
Okay.
It's some really cool work. You should look it up online. It
It's-
doesn't involve needles, it involves mirrors.
one of the guys that did the endocranial release on me, he studied at the Carrick Institute, did functional NCR, basically neurocranial, whatever.
Uh-huh.
And a lot of his testing came from the Carrick Institute, and I went through a lot of the tests with vestibular things and vestibular eye retraining
Yes,
that came through that institute, and that was a
very cool.
fascinating person.
Does anybody want to get a book?
I do.
Okay.
Is it Carrie? K-E-R?
How do you spell Carrick Institute?
Yeah, I think it's C-A-R-R-I-C-K, Carrick Institute in Florida. They basically do a lot with the vets that come back with blown.
Let's talk about one more thing that's also really interesting. We started to talk a little bit about platelet-rich plasma and stem cells. I want to talk a little bit about what else you can do with them. One of the things we can treat is erectile and sexual dysfunction in men. You can actually grow new nerves and new blood vessels in the penis, and in many cases make it work better than it was working a month ago. You can inject it around the urethra in a woman and greatly reduce stress incontinence when you cough and sneeze and laugh and bounce on a horse too much. You can also restore sexual function in a woman by injecting those parts with the same stuff and growing new nerves and new blood vessels in them also. You can rejuvenate face skin. I have a device that'll make 1,000 teeny tiny holes in your skin per second. And we put your stem cells or platelet-rich plasma on top, poke it in with these needles, and you'll watch over the next 1 to 2 months, you'll watch your face tighten, you'll watch your wrinkles flatten, you'll watch your scars flatten. That's pretty cool too. You can do skin anywhere on your body if you want to rejuvenate that, and then you never look like you had a facelift because your skin naturally regrew and thickened. Because what happens when you injure yourself? You regrow and you thicken. In 1,000 holes a second, you're going to have an injury to heal.
You didn't have a
So you look-
facelift, you had a rejuvenation.
A rejuvenation. And you look a little sunburned the next day, but 2 days later you look mostly normal. And mostly normal. In case there were a little bit parts where you said, go deeper there, I want that deeper, that might still not look normal. So there's lots of things we can do. Stretch marks in the abdomen respond really well to this treatment. So there's many parts to these different things that we can do with these same tools that 5 years ago, 10 years ago, 20 years ago, never even knew
How many sessions does
possible.
one need
for face.
for
Face is usually 3, but you'll see a change in 1.
and stretch marks?
Stretch marks, you'll see a change in 1, but usually 3. And you can even do it with hyaluronic acid and make it fairly inexpensive. You don't have to use blood products. But the blood products work faster and better. They make a bigger healing. Yes?
You said cow milk is a no-no. What about goat, sheep?
So
What's the difference?
the difference between cow and goat milk is the size of the fat globules and the proteins that are in them. And my body will handle goat milk and goat cheese, but it will not handle cow at all. And we're using ghee from water buffalo because we found it in a local store. Now I've seen water buffalo on National Geographic. I don't know how you get milk out of it because they're always really big and they're in the water. I can't imagine how that, but
And they're
I learned that
fierce.
they're domesticated and they pull plows in India. And I'm thinking, a water buffalo to a mule is like a Toyota pickup to an F-350. Water buffaloes are pretty big, at least ones I've seen on.
So they would notice someone pulling milk.
So there's a big difference between milk from one source and milk from another. And one of the worst things to feed a baby is formula. The universal donor is goat. If you can't feed from mom, you should feed from goat. And then there's some vitamin maybe to add folic acid to the goat milk if that's all you're feeding the infant. But they'll do much better on goat milk than they will on formula, almost to a T.
So where's your
My
office?
daughter was adopted, and so I could breastfeed her, and so the first doctor that I brought her to, I told him that I was feeding her raw goat milk. And he said, oh, you have to give her formula, she won't thrive when it's just goat milk.
Yeah, really.
She was already really thriving. So I left that doctor, and then I found another doctor, and I said, I'm feeding my daughter raw goat milk. And she said, oh, I wish all of my patients were on raw goat milk. I wouldn't have to see them so often.
There you go.
When was that?
My daughter's 24.
So how,
And I had to drive, I have a house in northern New Jersey,
yeah.
and I had to drive yet north another hour to go to the goat farm to get that every week, raw goat milk.
Wow. So where's your office?
Oh, so my office says 20 East 46th Street, right by Madison, 46th and Madison, 7th floor. We schedule appointments. I have a New York phone number that I can give. It comes to my cell phone, but much easier if you call our Cincinnati office and schedule it through there. Our main operation and research center is in Cincinnati, Ohio. That's where we've learned all this stuff. And we bring our A game to New York, and I'm here 3 days, Wednesday, Thursday, Friday, once a month, unless I have to miss for one reason or another. And that's the way it's been.
Or emails, how they can always.
Email works. You can always get me by email. And we can do phone visits too. But if I'm going to touch you, I'm in New York, I'm here usually once a month.
I just want to amend how I introduced him. I said that he said some things in the last talk that I had not known or heard of. I'm going to say tonight, everything he said, I did not know. Everything you said is new to me.
Except for the goat.
Except
Yeah,
for the
you
goat.
knew about the goat.
I knew about the goat.
All right. So my New York phone number,
You have cards?
I do have cards. 212-304-8900. I don't call it enough to know. 304-8900. Our Cincinnati number is 513-956-3200, and my email address is on the cards. You can look us up at blatmanhealthandwellness.com. I have a lot of stuff online. Website's pretty good, teaches a lot. Has been around, and we've been developing it pretty strongly for the last couple of years.
Where do you do the doctor course?
Cincinnati. The doctor courses are in Cincinnati because that's where I can grant CME credit.
How long are they?
20 hours. They start Friday at noon and go till Sunday at noon. And they go Friday night till 9 or 10 o'clock at night. That's how we get 18 hours in, pass them around. Those are the Cincinnati cards with the email address works and the number to schedule works, and that's the easiest place because I have staff that can answer the phone and I don't have staff that answers my cell phone.
We're gonna have to pass a few more out, huh?
You don't have a Cincinnati card, you have a New York card, I can't read which number is on it, but it does have the right email address.
That card has both.
I have some cards if you want.
Do you have some cards?
Here.
Here's some more. One more. I do. Here, the New York card has a New York address, but it may not have the 212 phone number.
But it's supposed to call the Cincinnati number.
It's better to schedule and calling the Cincinnati number. Right. Here's some more cards. 'Cause then you have a real person to talk to, and they can coach you to fill out the forms you need to fill out.
So I got the book. The book is fun and it's interesting and it's thorough. And, you know, when you have questions about something that's bothering you, you can consult it by checking the back out, looking up the issue in your tissue.
When you want. Pardon? Can you can buy one of these if you're one of the first 2 people to want one. These are $45.
There's one left. She's got this.
She's got one. Do you want the other one?
Now there's no left.
You have plenty of books. And I have plenty of books.
I have this one.
Oh no, this one goes home with me. I never leave home without that. It goes on every airplane all around the world I've ever been. That comes with me.
TSA feel.
It's in my suitcase. TSA doesn't know. But I loosen my shoulders every single morning. And
your button?
no, it's not.
I think they look like nunchucks.
We order them, and they come apart. This comes apart and fits in your suitcase. It unscrews here and here. And these balls unscrew and go closer and further away, if you're bigger or small. Yeah, please. What do you want to try it on? There? So, come this way. I can take credit. Oh.
But the head injury was.
No, I left my dog at home. I can take a picture of your credit card and get your phone number written down. I'll do that.
Not the symptoms.
String in the back.
You know so much.
Take all the slides all the way up to the end of the string.
So what's your profession?
Place the front ball and bring them together.
Yoga teacher?
Got where you want it? Now turn your head left and right
Pilates.
and the other way. Face me and tilt left and right.
A lot of times
It
it
was all taken away from me.
And then release
I
this
couldn't walk for 2 years.
and see how much different you are.
That's it. I lost another client now.
It's really different, isn't it? Yeah. So right away, your body's different. You don't have to wait till tomorrow to find out if you touched the right thing. Yeah, but now you don't need your suitcase all the time. Now you don't need him all the time. And when he does have time to come work on you, it'll be different. Because all the hard work has already been done, because this squeeze is really hard. Okay. That, I don't use that on the back. No, I use the rubber ball on the back. The rubber balls.
And that's that.
No. Rubber balls are here. And if you get a book and I have enough balls left, you get a free ball, and otherwise you have to come get a ball later. The books are 25 plus. I'll look on the cover. So you take this ball, you would go over to the wall, you cross your arms and tuck them in like this. Tuck them in, like the rheumatic. And then this ball is going to go right here, and you're going to go against the wall and do this kind of thing right on that mouth. Pardon?
Just lean into it and roll around. Anywhere that you have.
Yeah, lying down puts a lot of pressure on it. The wall is easier for most people to start on. And you can do these, and you can do your back, and you can do your neck.
No, I work for them.
Isn't this fun? Here, you can hold that. Okay. Yeah, I think so maybe this will really make some big changes. Yes, and they're missing everything I said. But then I don't do the things they do. So it goes both ways, right? You'll need them different. Different what we do works.
I know. I was, but they're not.
And you can start with the ball. Don't use the ball on your bones, use it on your muscles. Yes. I haven't seen it. I don't know. The biomodulator thing with the headphones? Okay. All right, let's give it a look. So the books are $25. And then you get a ball. And if you want, yes.
Hi, honey, how are you? How are you feeling? What time did you get in? 5?
Yeah, the bike.
Tired?